Continuing coverage now on a generation at risk. New research from doctors shows up to 300,000 young children are depressed right now. Experts saying America's youngest are facing a mental health crisis. We're going beyond the headlines right now. Welcome Dr. Craig Allen, Medical Director at Rushford Addiction and Mental Health Treatment Programs for Children, Teens, and Adults. Thanks for coming in today. An important topic. We were just talking about this. We have a couple of issues here. First of all, a sense of isolation or depression for teens, then a lot of times people not knowing what to do.
Right. So when you talk about texting, you talk about social media, it seems as though everyone's more connected, everyone's communicating better. This should be a great thing, and it can be very helpful. But for adolescents who are developing skills, communication skills, the skills that they're going to need in the future to negotiate conflict or to get a job or to develop a romantic relationship and have a family, that is human speech. That's how we evolved. That's how our species communicates. We didn't evolve to just use text, which have eliminated all of the human contact. And it can be isolating rather than connecting. And it can lead to feelings of depression. And certainly it's a platform where, as with cyberbullying, it can lead to much more cruelty than an in-person conversation. People will text, kids will text stuff that they would never say face-to-face.
Right.
Partly because they could see what it's doing to the person they're talking to. Facial expression, body posture, a gasp. You don't get that in texting.
And for the victim, there's no escape from it now. Like there was 20 years ago, you only dealt with it in person.
I tell you, when you had a breakup, back when I was in school, it was terrible. It was miserable. I was an adolescent. But I could go home, I could play basketball, I could talk to my friends, I could forget about it. Now, 24/7 you get those texts. And we are sort of designed to respond to those texts as though they're important whether they are or not, even us adults.
That can lead to all sorts of problems. So help us recognize, for parents or people who care about somebody who may be at risk, how do you recognize the signs of a problem?
Well, someone who's spending more and more time on their phone, someone who is starting to isolate, maybe they're not engaging in activities that they used to enjoy. Maybe they're even talking about how hopeless and helpless they feel. One of the things that, can precipitate a really serious event is someone who is publicly shamed. And what is this cyberbullying if not public and, as you say, 24/7 shaming and humiliation? So it's not okay to pry into your kid's personal material, but if you have a concern, I think you're going to have to check the text. And I think that there's two things that we should do. One is to set good examples about how we're using social media, how we're using cell phones, how we're using texting, and also monitor the amount of time that our kids are doing it. We want our kids to develop the skills that they need in relationships that have to do with real-time, in-person communication. That doesn't eliminate cell phones at all, but that's something that if it's missed, kids are going to be at a huge disadvantage as they grow up.
Okay, so does that mean encouraging your kids to spend more face-to-face time with their friends?
Yes, more face-to-face time with their friends, maybe even some with their parents at dinner, no texting. Those are the kinds of things that are going to be really helpful and important to keep an eye on.
All right. Realistic to think that you can limit the screen time that your kids have, especially when they reach a certain age, like their middle teens?
Well, who owns the phone and who's paying the bill? I think it's realistic to try and limit it, but I know, having teenage kids myself, that it's quite a challenge.
Okay. The good news is there are treatment programs out there, right?
There's treatment for kids who are depressed, who develop anxiety disorders, and if a kid is showing those signs and symptoms, talk to your pediatrician or contact a mental health professional to do a further assessment and make some recommendations and make sure your kid's on the right path.
Critical advice. Dr. Allen, thank you so much for coming in.
Sure, thank you very much.
Put on the screen where you can get more information if you need it. You can call 211, of course, or 1-800-273-8255.